Hi, everybody. Most of you know me by now. I'm a pediatrician. I work in Madrid, and I am an ESOP member since 2003 and became ESOP's General Secretary in 2017. Since then, I've been working elbow with Jeff, and work keeps piling up, but at the same time, it's a lot of fun and I'm learning a lot. And here I find myself today moderating this webinar session. I have to say that I feel very honored to be moderating Drs. David Pencheon and Todd Sack. I met them for the first time 2 weeks ago, and it was a very inspiring and enlightening experience. Early in their careers, both David Pencheon and Todd Sack have seen it clear that something big needs to be done if we want to save our planet, and that we need to change our way of living and our way of consuming. Dr. David Pencheon has been working on an institutional level. He's a UK trained doctor, and the way he introduced himself the first time I met him was he's an ordinary physician, which is, I thought, was very humble of him to say so. And he led the UK's NHS Sustainable Development Unit in helping fulfill its potential as a leading sustainable and low carbon organization. David Pencheon has always had a keen interest in sustainability, and he and his team have worked tirelessly to promote the benefits of sustainable healthcare, not only nationally, but also internationally. He was awarded an OBE in the New Year's Honors List 2012 for services to the public health and the NHS, and in 2020 was awarded the BMJ Award, Outstanding Contribution to Health. He left the SDU in 2018, and he's now an honorary professor at the Medical and Health School at the University of Exeter in the UK, and collaborator with the European Centre for Environment and Health and the Global Systems Institute. His current area of research is how we get practical and radical on creating the conditions most likely to promote environmental, social, and economic sustainability for life-promoting planetary systems. And on the other hand, we have Dr. Todd Sack. He has been working with climate change on an individual and systems level. He is a graduate of Yale College and received his medical degree from the University of California in San Francisco. He became a gastroenterologist and hepatologist working in private practice, but also had a big interest in climate change, and this brought him to become the editor of mygreendoctor.org, which is a free environmental service of the Florida and the World Medical Associations that helps medical offices adopt sustainable practices. And by the way, I have subscribed today to My Green Doctor in the Spanish version. So hopefully I'll become a green doctor as well. He's a member of numerous environmental and medical organizations in the US, and today he will talk about how we can become green doctors. So we have two distinct physicians on the opposite sides of the Atlantic that will delight us with their experience in how to win the battle on climate change, from the individual level through the systems and institutional levels. So let me start with you, Todd. And in 10 minutes, can you tell us a little bit of your journey and how you became involved with climate change and what have you accomplished? And then after 10 minutes, I'll ask David Pencheon the same question.
Thank you, Dr. Rubio. What a treat to be with you and Dr. Pencheon and this esteemed group. And thank you, Dr. Goldhagen, for inviting me. Maybe I'll go ahead and share slides and show you a quick PowerPoint to summarize what I'm doing. If it'll work, let's see. It might work. Slideshow from the beginning. All right, great. Dr. Rubio, give me a thumbs up if you see my slides. All right.
I do.
All right, thank you. Here we go. So today we're talking about greening practices in health systems, and I'm going to be talking mostly on the practice side in my brief introduction, because we're going to enter a really neat conversation in a few minutes, but I wanted to first give you some background as to what I'm working on, and I also want to try to inspire you to get engaged in in your offices, in your practices, in your bureaus on this. So there we go. I'm going to skip the slide about me. I'm going to talk about this briefly. This is the foundation I speak for, the My Green Doctor Foundation, which is a nonprofit 501c3 charity in the United States. And we offer climate change teaching materials for patients of historically disadvantaged communities around the world. Our organization has access to thousands of waiting rooms where we can directly talk to patients and their families and their communities about the important issues of sustainability, climate change in their own lives. We have brochures and posters and handouts, PowerPoints, and lots more. Currently, we're in 2 languages, mygreendoctor.org, G-R-E-N, mygreendoctor.org, and mygreendoctor.es for our Spanish-speaking colleagues and patients. But I want to talk a bit about what the world is going to be like if we stay on business as usual. This is my state of Florida during the middle Miocene 18 million years ago, when we last had carbon dioxide levels where we are today, over 415 parts per million. And you see the outline of Florida's current geography, but what will look like when all the glaciers are melted and the seas have risen. There'll be nothing left significant to Florida. And this is what we face around the world. But I want to say it's not just the next century we're worried about. It's also today. This is my town of Jacksonville, Florida, after Hurricane Irma in 2017. And you see these vast areas where thousands of homes of middle class and lower middle class people were flooded. And of course, economic devastation is obvious, but the health consequences are spectacular and devastating for these communities. This is not 100 years from now. And this is why we as health professionals need to get better engaged. In the next 6 minutes or so, I'm going to talk about the importance of outpatient healthcare practices. And when I say outpatient healthcare practice, I mean your clinics, your bureaus, your offices, your imaging centers, your diagnostic centers, any kind of outpatient care. What resources are available for greening practices? I'm going to talk about one resource in specifics, My Green Doctor, and we're going to get you started today. That's the plan for this hour. Healthcare practices are important because there are millions of our practices worldwide. We actually can cause illness. The EPA in the United States tells us that the inside air is dirtier than the outside air commonly because of chemicals and particulates, fungi, ozone, and other materials. We use significant resources, electricity, water, paper, chemicals, and foods as well. Our offices are often high cost and inefficient. As I'm going to tell in a few minutes, outpatient medicine is responsible for 28% of the healthcare industry's greenhouse gases in the United States. And I suspect if we looked at other parts of the world, healthcare in the outpatient setting would be even a higher proportion. And finally, most importantly, we are important role models for the community. If we go green, and we're willing to teach our patients how to go green, to share this wise information with them, we can have a huge impact, not just on the health of our own little clinic, but on the health of the world. This is a slide from a paper that I wrote recently, drawing on Eckelman and Sherman's data from PLOS One in 2016, which looks at the U.S. healthcare's contribution to greenhouse gases by service type. Now, remember that in the United States, healthcare is 10% of America's mammoth greenhouse gas production. We're 10%. Of that, 36% is hospital care, 28% actually is outpatient care. So the role of our clinics or offices is not a trivial contribution to greenhouse gases. We make a difference. And we're also the most trusted portions of our society. This is from a survey in the United States in 2017, asking people who they trust. And right at the top are healthcare professionals, nurses, medical doctors, and pharmacists in the top 5. So we have the authority and the power and the respect to talk to our patients, to talk to our communities about important issues that affect their health, including energy use, water use, chemicals, and climate change. And we can make a difference for them by communicating effectively. Okay, this is a list of resources for greening practices, all free online. I don't have the time to talk about all of them now, but you'll have the PowerPoint to refer to later. My Green Doctor, I'm talking about in a few minutes. Another one I really love is the Royal College of General Practitioners Green Impact for Health, which is a really neat system with great ideas and a great scoring system. And there are others, the American College of Physicians, the British Medical Association, the Pediatric Environmental Health Toolkit in the United States that ACOG offers, and AAP. So these are great resources. Let's talk, though, for about 5 minutes about My Green Doctor. This is an online environmental sustainability practice management program. It's available in English and in Spanish. It's used now by thousands of health professionals in 48 states and at least 80 countries. And notably, 12 health professional organizations provide My Green Doctor to their members as a free membership benefit. Participating in My Green Doctor is free for the society and free for the member. So there's really, it's a no-brainer to participate with us. This resource is really useful for any type of outpatient healthcare office or facility. It's easy to use, fully scripted and free. It's comprehensive, science-based, and non-political. And most offices save money in the first month. And for physicians, that's often the hook that gets them to be interested in reading to the second sentence. These are a list of our partners, big organizations like the World Medical Association, the American Academy of Family Physicians, the American Academy of Dermatology, and smaller groups like the Climate Psychiatry Alliance and the Alliance of Nurses for a Healthy Environment. And we'd like one day to see ISOP's logo here if possible. How to use My Green Doctor? We ask anyone, whether you're a big institution or a small practice, to adopt sustainability as a core value for your practice. Talk about sustainability among your peers and your patients, and make it just as important as high-quality patient care and good communication. Register at mygreendoctor.org or .es. Anyone can register. You don't have to be a health professional to register. And when you register, you get a free pledge certificate. Print that up and display it proudly in your waiting room and in your break room. Next, plan to add 5 minutes of Green Team business, My Green Doctor business, to each regular practice management meeting. You don't need an extra meeting. Just add 5 minutes of this important work and commit to earning the Green Doctor Office certificate that you can also proudly pledge. You have a real goal for your practice in your green endeavors. We have a meeting by meeting guide that adds just 5 minutes of My Green Doctor business to each regular practice meeting. Each 5-minute session is fully scripted, explains exactly what to say and what to do. There's really nothing for the office manager or you as a lead on this project to study or prepare. And we focus on very slow, steady improvements, little by little. And over a couple of months, you make a really big difference for your office and the environment. Also, we emphasize patient and staff teaching, and we provide all the materials for that in English and Spanish. We encourage discussion and staff involvement. People in the office love to go to these meetings. It really enhances their enjoyment of their place of employment. And we provide a Green Team notes form for easy record keeping. You just print out or mail us the Green Team notes form and you get your certificate. These are some of the solutions that you find at My Green Doctor in our workbooks. We talk a lot about carbon footprint and the energy impact of an office. We talk about measures to save energy with the right appliances and use of those appliances. We talk a lot about chemicals, cleaning products, office products, and standards that are available in the United States and around the world for buying the right chemicals. Recycling, of course, avoiding unnecessary products like styrofoam, and healthy foods, healthy for the patients, healthy for the environment. We have more than 120 topics that we offer for officers to work on, but these are the core subjects. We have lots of teaching materials. Up on the right, you see a poster that we offer. We also have lots of brochures and dozens of teaching tips. And finally, you see our pledge certificate in the lower right that you get just for registering. It's available in any language you'd like. We sent it out already in 10 different languages around the world. So lots of ways to brag about the good work that you're doing, so your patients and your colleagues in the office see the wonderful projects you have underway. Just a moment about educational materials. We have brochures, posters, a tip of the month program, essays, a quality improvement curriculum for medical students, and education courses for professionals. There's a recognition certificate. This is earned by a primary care physician in Maine. And lastly, an example of a success story. This is the Escambia County Health County, 5 offices in the Florida Panhandle. They've been saving energy every month on our program. The bottom line, $14,000 saved annually, 85,000 metric tons of carbon dioxide per year. And 2 years ago, they actually built solar panels for one of their big offices with the money that they'd saved. Okay, lastly, getting you started. Please register today at mygreendoctor.org or .es. It takes 90 seconds. It's free. No password is requested. Next, ask your organizations to participate in My Green Doctor. Send me an email and I'll tell you how it's done. This is good for your organization, great for your practice, and great for your society. And there's some membership benefits that I won't share with you now. Adopt environmental sustainability as a core value. Talk to those leaders in your practice and just to declare to everyone, this is what we do as a practice. This is what we do as an organization. Add 5 minutes of Green Team, My Green Doctor business to each practice planning meeting, and go ahead and earn that Green Doctor Office certificate. You'll be proud, and your patients will be proud of you as well. Thank you very much. Barbara, back to you.
Thank you, Todd. That was really, really very interesting. And like I said, I registered just today for the Spanish version. So let's see how it goes, because here in Spain, on the health professional, it is not as well disseminated. You know, the climate change. They don't doing something from our level is not really. I haven't seen it around my colleagues and hospital and office. So anyway, so thank you for that. And now we'll go to David Pencheon, and the same question. Tell us a little bit about your journey and how you became involved in climate change, and what have you accomplished so far, which I think is a lot.
Well, thank you very much indeed, Barbara, and thanks, Todd, for that. And so I'll just share a few slides with you before we get into the conversation. And what I thought I would do is address some of the issues that I, in fact, have learned quite recently about how you engage other people in this. And so I'm just going to share a few tips and tricks that have been really helpful for me. And I've learned these from other people, actually. So these aren't my original ideas. I mean, the first advice I'd give to all health professionals, pediatricians, everybody, is to start framing the climate and ecological crisis as a health crisis. So, because that's our business. And when you saw Todd's slide about how much we are trusted, rightly or wrongly as health professionals, we need to stay in the zone where we have credibility. We shouldn't be talking as though we were second-rate environmentalists. We should talk as though we're first-class physicians and surgeons and pediatricians. So I'd strongly advise people to talk about this and engage other people, patients, managers, chief executives, politicians, public, as a health crisis. And as you've already heard, we are trusted and we're usually good communicators. So one of the issues about that, and I learned this the hard way, I suppose, is that by saying nothing, by doing nothing, that is dangerous. That is not neutral, it's dangerous. I think you have to remember what it was like when tobacco was much more prevalent than it is now, in that by doing nothing, by saying nothing about tobacco, people will justify their habits by saying, for instance, well, if smoking were dangerous, then my doctor would tell me, my nurse would tell me, my doctor wouldn't smoke in front of me. Similarly, if we stay silent on climate change, people will learn to believe that if it were a health hazard, if it were a health risk, then doctors would say something. So we should say something. That doesn't mean we are experts, and we should not pretend to be experts, but we should share our concern, and we should share the data that we know about the health risks that you've heard Todd talk about. The third thing is, if you work in a big practice or a big hospital, we as health organizations are, in a sense, anchor organizations. We're not going anywhere. We're big. We employ a lot of people. We buy a lot of stuff. We set big examples. We have big partners in local government and other institutions in our local area. Therefore, we can flex the system sheerly through our size. So that means, I'm afraid, rather boring things like where we buy our stuff from, where we buy our food from, where we buy our nurses' uniforms from, where we buy our surgical instruments from. I suspect many of you around the world have heard about things like fair trade coffee or fair trade cotton, but I wonder whether we've heard enough about fair trade surgical instruments, fair trade drugs, fair trade nurses' uniforms. And the power that we have as doctors and nurses is not to lecture other people. It's not even to be experts at these things. It's just to be gentle, persistent, clear, inquirers and helpers of other people in the system. So if you have a director of procurement in your hospital, go along to him or her and say, I'm concerned about climate change. How can I help? Because I know procurement is about 2/3 of the footprint of this hospital. That's all you need to know, and that's all you need to say. It's very difficult for people to resist your attention if all you're doing is offering your help, offering your assistance, sharing your concern. And that gets away from the fact that, you know, a lot of people are put off by people who lecture them or harass them or induce guilt through climate change, but simply to help and to act together in the common interests of current and future generations. And that current and future is very important, because we're not just talking about the health of people 50 or 100 years ahead through things like better food, cleaner air, more active transport and travel. We're talking about immediate health benefits and long-term health benefits. So there are win-wins there. And of course, for younger people, for children, helping people adopt these habits young, where they get much more ingrained into the natural way of living, is much easier and confers much longer benefits. And as we've seen by this wonderful call put together by ESOP, health systems are part of global networks. We can spread our message, we can perpetuate our values much more effectively through the strong and trusted global networks we have that transcend countries, that transcend cultures, that transcend disciplines. So just to remind you that, of course, health is by and large improved by the health and care system, and climate change is bad for both of them. But also we have a duty, not as working in a health and care system, not to exacerbate climate change. So do no harm. Do no harm is part of our mantra. Do no harm is part of our values. So we have a responsibility to reduce and ultimately eliminate our negative impact on climate change and be seen to be doing so. We need to do this visibly, at scale and pace, to show that it's a normal responsibility of every large organization, commercial, public sector, private sector, third sector, government sector. And we, I guess, as health professionals, have a very proud heritage of taking action on everything from tobacco, slavery, abolition, cholera, nuclear proliferation. But I'm not sure we're convinced, any of us are convinced, that health professionals have really got a grip on what the Lancet calls the biggest health challenge that faces us in the 21st century. And in a sense, the biggest health opportunity for making health systems truly deliver health, not just address disease. So one of the things we did, Barbara challenged me to say, what are the things you've done in the UK? Well, it may not sound very much, but this used to be the mantra of the NHS in England, high quality care for all, not a bad mantra. But now it's this, now and for future generations, just to bind in, to weave into our mantra that we have a responsibility for those people who have no choice and no voice in their future. And you may be interested to know, if you don't already know, that less than 24 hours ago, a court in Australia upheld the right of 4 young people aged less than 18 to take their Minister of Environment to court, and successfully got the judge to say the Minister of the Environment has a duty of care for future generations. Now, these sort of pronouncements by the legal system have a huge impact on legitimizing the concern of people like us on this call who have an anxiety or a feeling of moral obligation. This is fast becoming a legal obligation of us all to look out for not just current generations, but future generations, to help bind it into our duty of care. And I would thoroughly recommend that phrase, we have a duty of care. And Sir Simon Stevens, who's the Chief Executive of the National Health Service in England, has very cleverly and with profound leadership shown that we can do both urgent things like COVID and important things like the ecological emergency together. It's not as if we should be so short-sighted to say, don't bother me about climate change, I'm too busy doing COVID. I know that tens and hundreds of thousands of health professionals are working all hours of the day and night on COVID currently, but we have to remember the long-term game is to preserve all those systems on which a healthy and fair life depends, as this cartoon shows us. So we know what the reasons are. We won't go into those. We'll have those in the discussions. I just want to remind you finally, this is the sort of final slide I was going to use at this stage, was it's very important to understand, to listen to people, especially formal leaders, why they might get engaged. And it's very inspiring to hear different people get engaged. But different people, health professionals and health administrators and leaders, will get involved for different reasons. They might, as Todd says so eloquently, you know, let's be realistic, they'll get involved to save money, the bottom line. That's a very strong engagement. But they might get involved because they want to comply with regulations or scrutiny, and they might get involved because we feel people have a moral obligation to set a socially and ethically responsible example. The scientific evidence is very, very strong. We all know that, but we also know that science is not what drives people's behavior by and large, and that's very, very important. And the last thing is to meet the expectations of others. So the final bit of advice that I would give is to, instead of talking to people about this, is to listen to people. Be curious about why different people, your colleagues, your patients, your family, your community compatriots, are intrigued or curious or anxious or concerned about this. Listening is the way to someone's values, and once you know people's values, you can help them live a life that is fulfilled by acting on those values. So I'm going to stop there, Barbara, and I'm going to, you know, very much look forward to hearing people's comments and questions and sharing both our experience, but also the great case studies, for instance, that you've heard from Todd and others on this lecture series.
Thank you, David, so much. It was really, really inspiring, and I think you touched very important points, like making it a health issue, which it is, you know, but we don't have that, you know, in our minds, and also the ethical obligation we have of doing no harm, you know, and climate change is doing a lot of harm. So I mean, that and all the other tips. Thank you very much. And I don't know if there's any questions in the chat box. I don't see many, but anyway, I also wanted to ask both of you, what obstacles have you encountered in your journeys? And do you see a light at the end of the tunnel?
Well, I'll start first then. Well, the obstacles of the health professionals are just so busy. We're so busy with all the issues of practice and the loving care we give to patients. And then COVID hit. I think COVID became a wake-up call to all of us that our healthcare systems are not as resilient. And I see people now being willing to turn to the climate crisis as the next episode to work on. And so I've been encouraged. I see much more interest in this. Look at this wonderful meeting and how you've drawn attention to it. So the challenge has been we're all so busy. And the challenge is, how do we engage people? We try to make it easy for them, but how do we engage them? And I really get to hear how David does that at the bigger level.
Yes, so that's a really great question, Barbara, and I would absolutely agree with what Todd says. I think one of the real challenges, one of the real difficulties is not just busyness, although we are busy, but that busyness gives us a very good excuse not to do things. So just to make this real, a lot of my clinical colleagues would say to me, not so much now, but 10 years ago, they would say, you know, I respect what you're doing, David, but quite frankly, I'm too busy saving patients to save the planet, which is absolutely understandable. But I don't think we weave the narrative together well enough to show that actually a concern for things that create health, all those conditions that create health, are probably the best things that health professionals can do. Sure, we can help pick up the pieces when things happen which are unpredictable and unforeseeable and unpreventable. But a lot of things are preventable in the world, a huge number of things. And if they're preventable, why don't we prevent them? And climate change is making those things much more difficult. But I am indeed guilty of that myself, because when I was very young, adolescent, before I even went to medical school, I was a very active environmentalist. But as soon as I went to medical school and became a doctor, I started thinking, well, no, I'm going to buy myself into heaven in a different way. I'm already doing good things. I've ticked that box of a good person. I didn't have the foresight or the breadth to understand that I could do great things, both as a direct clinician and out on the wider platform of saying we as health professionals should be speaking up on things like acid rain or nuclear disarmament. And I think we've got to remember that when doctors and nurses speak up on the wider health issues, as long as they're clearly health issues, and for instance, modern day slavery or nuclear disarmament or uncontrolled migration of children, they are health issues, and we should stick to that narrative of health issues. When we say things about that, people will take notice for the reasons that Todd showed from that Gallup poll data. These are really important things. So it wasn't until I managed to weave together both a sort of individual level, listening, talking, advocating, acting, with working on a political system level. Not that I found I was working twice as hard, but just selfishly, I felt very much more fulfilled. I felt like I was living my values. And coming back to another thing that Todd said about a happy workforce is a productive workforce which helps its patients. And a happy workforce is a workforce that is allowed to live its values. So legitimizing some of these actions about sustainable food or reducing emissions, not only at home, but at work, gives you a better workforce, and a better workforce gives you better health for more patients.
Yeah, I totally agree with that. I have a question for David from Tony Waterston. What progress is being made with sustainable procurement, which is dependent on other organizations which may be less green, and in particular with single-use equipment, which is thrown away every day?
Yeah, well, that's another great question. It's another very practical question as well, because when we first started doing research on procurement, which sounds a rather dry and backroom function, we realized that well over half the footprint of any healthcare system in the world comes from what we buy, the stuff we buy. And that's true in our homes as well, incidentally. It's not just the energy or our travel, it's what we buy. So that's a really important question. Now, one of the things we realized, Tony, about this was that we also thought that how we're going to convince these less than green organizations to make their supply chains and their offers much more sustainable. But actually, we found slightly the opposite, in that there were lots of very innovative producers of equipment, of buildings, of, I can't really say drugs, but lots of things that are sold to the health service that were much more sustainable, but maybe cost 1% or 2% more. Okay. Now, unfortunately, that was a deal breaker. So we didn't need to work on those producers. We needed to work on our own internal contracting processes that bound in to part of the contracting process phrases like, we need a new hospital built, and we reserve the right to take the green credentials of the architects, the designers, the builders seriously, and we will judge them accordingly. Okay. And so what the key lesson for me, Tony, was you need in your contracting process to legitimize the innovation of the hundreds of millions of dollars spent around the world on healthcare, to legitimize those people to say, actually, if we green up our game as a supplier to the healthcare system, we stand a much better chance of winning those big contracts. And so the creativity needed to be stimulated is within our system, Tony. And that's, I would say, go to your director of procurement and say, how can I help? That's a real way in, and very productive, because you'll learn about them and they'll learn about you.
Okay, thank you for that. And I have a question for Todd. Can what we are learning about vaccine hesitancy deniers be applied to climate change hesitancy deniers? And if so, what have we learned that can be applied? That's a tough question.
Yeah, I'm not sure we know what we've learned yet, because it's changing so differently in different communities. In the United States, only 20% of people were going to take the vaccines in September. Now 60% are eager to take it, and the other 40%, who they're probably the Trumpists, may never take it. We don't know. Climate change may function similarly. Public opinion has dramatically changed as a result of people seeing what's going on in the world around them. I think similar to COVID, people saw how terrible the experience was and how beneficial the vaccine was. And now we're seeing all the early adopters turn into having been right. How about in the climate change world? People are now seeing that renewable energy and some of the other solutions to climate change have good impacts. It means real jobs. It means public spending to improve infrastructure. It means improving our healthcare structures to be public health resilient. I think that's going to help as people see that it's really not painful. We're going to get more adopters in the climate change world too.
Yeah, I would add to that. I think that's a great answer. The other thing I would say, Barbara, this is advice again I would give, and I've got the scars on my back to show, is that it's very rarely profitable to get into hand-to-hand combat with climate change deniers. It's just wasting your time, really. The bigger prize is to be won not from deniers to helping deniers, is to helping what are called people who disavow. Now, this is a very interesting technical. These are people who don't deny that climate change. They just think it's happening in a different place. It's not happening in their world. They're not responsible for it. They're very happy to believe all the evidence. All of us, probably all of us on this call, have a little bit of disavowal within us. And this comes from the work of another sort of health professional, the psychologist Sally Weintraub and others, about understanding that we do have this capacity, this mental capacity, and it is quite a useful coping capacity for us as human beings to take things which are really quite scary and confusing and difficult for us to do and put them in a separate box in our head and protect ourselves in the sense that there's only so much truth we can hold without cracking. And that ability of human beings to disavow, to put it in a separate box, to say, yes, I am worried that it's happening. I agree that it's happening. I believe the evidence is happening, but I'm still going to fly, make my flights, weekly to Barcelona from England to my second home. It's that ability to live with contradictory material that in a sense is much more dangerous than a few sort of wacky deniers. So don't let yourself get diverted.
Yeah, you're right. Yeah, definitely. I think, and you're right. We all do that. I mean, I do that too, and but the more you hear about it, the more you say, well, we have to do something about it. I mean, all these webinar series are helping in that matter, I think, a lot.
Yeah.
And I have a question from Nick Spencer to Todd also. Your presentation specified a focus on disadvantaged communities. How has your work addressed these communities which may find it more difficult to respond to green advice?
Yeah, thank you. So migrant doctor is used by thousands of practitioners from all sorts of backgrounds, but we created this year a foundation to specifically raise money to be able to print and mail educational materials to at-risk communities, poor communities. So if you do work in a clinic in a poor community, please email me and we'll put you on our list to send you materials. Because we want to really prepare those communities that are at risk for flooding, the effects of great storms, for heat emergencies, pollution emergencies, so that they're better prepared than they are now.
There's another thing to say about poor communities, which I only learned, and I was very surprised by and very gratified by, in a sense, that, well, firstly, there needs to be a lot of recompensation from wealthy communities, wealthy countries that have, by and large, done more to contribute to the climate crisis. And there's a supreme planetary irony that those who've done least are suffering most. I mean, that's probably our strongest ethical card to play about this is simply not right. But there's a slight beneficial flip side to this, in that it's not just about, the white man helping the black man, or whatever ghastly phrase is used. A lot of the most inspiring action for a climate safe future is actually coming from poorer communities in the world. And this is because people who live in poorer communities know what it's like to live on the edge. They know that if they don't become climate resilient, they know that if they don't get their renewable energy system in, their children will not be able to learn in the evenings. If the crop fails, their children stand a chance of dying. So in many ways, there's learning in every direction. There's learning there's a lot of lessons we could learn, and a lot of poorer countries in the world are leapfrogging. We are slightly addicted to our high carbon habits in the north and the west. What you find is, for instance, in Africa, where there's no grid there's no national grid developing, we're going straight from no electricity to renewable electricity, and those are the sorts of that's the sort of scale and pace that we need in the north and the west and the wealthy and the so-called developed countries, is to understand that this is not a few LEDs and a few bike tracks. This is a revolution for survival in the social, economic, and environmental systems we live in.
Yeah, it is a social revolution. Yeah. There's a comment in the chat box. As clinicians, from Simon Lenton, as clinicians, we need to think about how we deliver clinical care. For example, pathways to ensure all the parts are in place and working well together to achieve equitable, effective, and efficient care that is good for people and the planet.
Yeah, I think Simon's point is very well made. I mean, if the question, and a lot of people have this very question, what's the best thing I can do as a nurse or a doctor? The best thing you can do initially is to practice high quality medicine. You know, don't over-treat, don't over-investigate, focus on prevention where you can. I mean, people often come to me and say, you know, the builders come and say, we want to build a really big sustainable hospital. And I have to be honest that one of my tempting responses to those things is that the most sustainable hospital is a hospital we don't need because we have far less preventable disease. But Simon's absolutely right that, you know, sustainable clinical pathways of care and prevention are, and that's why, coming back to Todd's point about binding it into the dimensions of quality, and you can see in that question there are, you know, the dimensions of quality like efficiency, effectiveness, and equity. Sustainability, which is not knowingly screwing up the future just to, you know, feather our own nest today, should be a dimension of quality. And it's gratifying to see Royal Colleges and institutions writing in sustainability as a dimension of quality. So anybody in any sort of leadership position or institutional position can pose that, can make that proposal to their colleagues to saying, I'm not sure what sustainability really means. I'm not a climate change expert, but I really believe we should have this as a dimension of quality. It's one of the most powerful things I've seen people do.
Yes, and there's another comment from Simon, which I missed before. Need to embed long-term thinking into everyday decision-making, especially within politics and policies. Wales has a minister for future generations. And there's the web address is mentioned there.
Quick comment.
Sure.
I was really stunned and thrilled to think that a country has a Home Minister for future generations. How exciting, and congratulations to Wales. I want to think as healthcare professionals to direct two ways to focus on this. At the individual patient level that David talked about, we can make a comment to every patient about what to do with the pharmaceutical that you're going to throw away, or remind people to recycle, remind them to go out in the park because that's good for the parks and good for them. Just add a little bit to your practice to each patient. One phrase can really make a difference. Raise awareness of the environment.
That's absolutely right. Yeah, Todd's got a very good, and even if we don't feel confident about adding something like, you know, I'm going to prescribe this because it's better for you, it's slightly cheaper. Oh, and incidentally, it has a less of an environmental impact, which is important. That's not a bad way of putting it. Even if we're not brave enough to take the conversation that extra 10 seconds, one thing we must absolutely be ready to do as clinicians is when patients ask us, are you worried about climate change, doctor, and should I be worried about it? I'm not suggesting I know exactly the right answer, because it will be very context and culture dependent, but we must have answers. We must say, well, don't ask me, I'm only a doctor, or I'm only a nurse. That's not my situation. You know, I'm interested in health, not climate. That's a disastrous way. So there are some, I mean, fortunately, in the UK, there's some medical students have written some great blogs recently about how to respond to patients who ask about climate change in a sympathetic, non-worrying, but clear, informative. And that's another great entry point, I think, is, and I can't remember who made the point, is that you have a right to know. That's it's a human rights issue in a sense. You have a right to know that the amount of air pollution that your local government allows is harmful for your health. You have a right to know that. And so the right to know is it may not be your bag, but for some of us, it's a great phrase. It's like duty of care. And these phrases that can hook people and suddenly make people realize, oh, it is an issue. Oh, I should be worried. Oh, I should be writing to my senator or my congresswoman or my MP or whatever it is. That is very important, to empower people to sit up, speak up, stand up, act up. So that's important.
Yeah. On that note, Tony also asks a question to both of you. Are doctors and health professionals doing enough to bring to government the urgency of the health crisis caused by global heating? Do you have any examples?
Well, I do have some examples, and I think one of the issues is that if you, as a solo person, go and nag your elected representative on your own and just say you must do something, you're unlikely to get anywhere. You'll be swatted away like a fly. What really seems to count, and this is a testable hypothesis, is if you go in numbers. You know, one person's a crank, two people's a pressure group, three people is public opinion. So numbers matter. So you act through your organizations, through your royal colleges, through the AMA, whatever it is, act in numbers. The second thing is, I have an unusually high regard for many politicians who I think work a hell of a lot harder than most people in the public interest. And so one of the ways I've tried to make that political point, Barbara, is to go to politicians, catch them saying something which is even half right, and say, that was great. How can I help you take it further? How can I help you is an important and powerful and open-minded engagement point. And even if they want you to do something which you wouldn't have thought was the top of your list, do it. Help them, understand them, engage with the political process positively and helpfully. It's young people who disengage from the political process that's one of the biggest global risks we face. And governments will have, and all of us will suffer a lot when young people just say, I don't see the point in engaging because my interests are not being served and my voice is not being heard.
Which is happening in many places.
It is. It is.
Let me add a comment to that. I agree completely with David. I want to explain two other ways where working with our professional societies can have impact. One is when your society has already adopted strong policies on climate and fracking and energy conservation and other topics and public health system, when you go as an individual to testify, or when you walk into a legislator's office to speak to their aide, you're not speaking for yourself, you're speaking for the organization. And that dramatically increases your power. But the other piece of it is that other organizations in your society will be watching what your professional society does. I've taken measures to the American Medical Association on climate and fossil fuel divestment, climate education, and other topics. And I see other environmental groups, other social groups referencing the American Medical Association and the House of Medicine in their work. So we're actually empowering other groups when we have our own organizations speak on these important topics. So don't discount the power of your specialist society, your local medical society. There really is power there by them having a voice.
Yeah, that's a great point, especially at that point one that Todd expounded there, which is it's sometimes more powerful not to say to a politician, I'm worried about climate change, but to say, my organization, which represents 65,000 pediatricians around the world, is very concerned. I know when we did the work about 10 years ago in the NHS in England, Barbara, one of the things which was very important was I would find myself in a politician's office or a senior civil servant's office, and they would say to me, so you think we ought to do this? To which my response was, no, not me. I only did the research. We asked 1,000 hospitals. We asked 10,000, clinicians, and the response we got was the highest response rate to any NHS voluntary survey ever done, that this is important and affects the health of current future generations. It's not my voice. I'm merely the messenger. I'm merely the principal investigator in the research that is elicited this strength of feeling, this commitment to action. It's up to you to decide how we make best use of this.
Well, Barbara, I have a question I've been dying to ask David. Could I?
Sure, of course.
I was stunned and quite jealous that you have a national health system with a sustainable development unit, and you've been directing it for 10 years. Do you see England's dedication as a unique example, or do you have suggestions on how we in other countries can replicate your model for national leadership on sustainable healthcare?
Yeah, I mean, it's a good question. I'm not entirely sure how we were so lucky. I think it was we were what I would call highly opportunistic. So we'd been trying for some years at a local level, at an individual level, to get action going. And in 2008, this is why I take national legislation like the well-being of future generations very seriously. National legislation suddenly came upon the statute books in the name of the Climate Change Act. And every government department, Todd, looked at each other and said, what should we be doing? And not me, but one of my colleagues said, well, the NHS needs to step up to the mark and not only do its bit, but actually lead and be a public sector exemplar. And as soon as I caught him doing that, I said, what a fantastic idea. I've been trying to do this. And I said, I'll help you in any way I can. What do you want me to do? I'll drop everything. I'll go anywhere. I'll speak to anybody. And we were very lucky. I mean, in that sense. The second thing we were very lucky in is another very perceptive leader said, don't set it up within government. Don't set it up in the Department of Health, too centralized, too bureaucratic, too process. Set it up in the engine room of the NHS. Set it up in the operational end, and get people to engage in terms of what I often call binding it into the dimensions of quality. So I think we were extraordinarily lucky. I think I work with colleagues in Australia quite a lot who have a federated system of government, as you do in the United States and many other countries. And there, the route map to systematizing this as a dimension of quality in the whole system is going to be different. It's very different. So I think you've got to be, it's a bit like the SDGs. All the SDGs are Sustainable Development Goals. They're all written out, but they play out very differently in every culture and country in the world. And it's about contextualizing, not confusing the destination with the different route maps to the destination. We're all going to have different route maps personally and institutionally and nationally to a safe and sustainable future. The issue is be prepared for, this is another very big principle that I've seen in other people is be prepared for change when other people are prepared. Okay, so get ready for change, because one day, Todd, a minister, a congressperson, a senator will turn around to you and she'll say, Todd, I've suddenly got, a $50 million grant. And you think, perfect, I know exactly what to do with that. You're not going to go away and think about it for 5 months. Now you need to take the plan out and say, this is wonderful. We've been thinking about this for a long time. So what I call planned opportunism is very important in large-scale political change.
Yeah, you have to meet, and you have to also meet the right person at the right time.
You do.
Like what happened to you. Yeah. That's a great example. I have I think we're already, it's already been an hour, but we have time for a few more questions. And there's a question for Todd. Are physicians writing prescriptions to address climate change? If so, what are these prescriptions?
Well, very few are, but there's several ways to do this. One is to use the electronic health record to embed a environmental health message or climate change method in some of the discharge plans. And that's something I'd love to work with someone to do, just short messages. I encourage people to take walks. I talk about recycling in the home. I talk about disposing of pharmaceuticals. I talk about public transit and healthy foods, healthy for the patients, healthy for the environment. So there are many brief conversations you can have. If you're doing that, send me those examples. I'd love to tell the world about how you communicate to your patients and that one-on-one experience.
See, I'm not a clinician anymore, Barbara, so I can't talk with any authority, but I do see many of my clinicians, in a sense, writing prescriptions for climate change, but doing it in a very subtle, indirect, non-threatening, oblique way, which I think is very clever, actually. It's a bit like saying, you know, we give you this prescription because it's cheaper, it's more effective, and incidentally, it's good for the environment. I mean, social prescribing is a term used a lot in this country at the moment, which is about prescribing non-pharmaceutically. So giving people vouchers for gyms, prescribing nature walks. I mean, I know that sometimes when you're in your consulting room, it does feel like a prescription is the only way to terminate, close a consultation. And the act of writing on a piece of paper and tearing it off and saying, not only do you get discounted vouchers for the fitness center, but actually I would recommend you join this walking club or whatever it is. And you know, it's good, it's nature contact. And of course, it will down the line, it has climate consequences and health consequences.
Yeah.
There's a great question in the chat box, Barbara. Excuse me for butting in, but
Yeah,
I think Lucy and Mark are talking about ministers for future generations. And Mark Hayden, quite rightly, understandably, says, you know, he's not holding his breath in England. But in fact, you often find that there's a hell of a lot of work going on behind the scenes. So if anybody on the call is from England, and if you want to write to Caroline Lucas in the House of Commons or Lord John Bird in the House of Lords, they are both working very closely together to get a Wellbeing of Future Generations Act on the statute book in England. And the voices of thoughtful health professionals in England would be incredibly useful.
And then there's more comments on on what we were talking before from Simon. Best way to influence ministers is an alliance between patients, manager, and clinicians, relevant stakeholders. They pose a reasonable answer to a problem that is on their desk, which is, and then there's another comment from Raúl Mercer from Argentina. And he says that young people are increasingly engaging in politics in Latin America as a way to question the traditional political establishment. So that's also, I think there's a lot of...
Yeah, I mean, I think it's pediatricians and people who are specialists with, you know, people who are younger. Anybody aged less than 40 has a much stronger moral authority to talk on this. You know, right down to, you know, people who would say, how dare you as an older generation speak on our behalf? And that it's very difficult to deny the fact that the best possible advice and the worst possible advice is not to be aged less than 40. Now, if you're aged less than 40, you have real reason to worry, big time. And that gives you much more moral authority to say, as our young friend and colleague from Sweden would say, how dare you? How dare you as politicians treat us as voiceless people? We are not. We have agency, we have voice. And when young people get together and address the UN, address Davos, you know, World Economic Forum, they have a voice that we don't. You know, many of us on this call are of the guilty generation that have known so much and done so little.
Yeah. And then there's a comment from Laurie Byron. In the States, frequently the local medical society is more important than the national medical societies. as the local ones are constituents. And this especially holds with conservative politicians. So that's with regards to what we were talking about before, how to make a difference. And well, I think we can round it up now. And I want to thank you both for this really, I have really learned a lot. I'm taking home a lot of tips, and I'm gonna start working on, first of all, winning my practice, and hopefully engaging my colleagues to do the same thing and grow on a bigger scale. So thank you, David. Thank you, Todd. And really, it was very nice meeting you. And I hope we can meet in other occasions. And if we can, from ESOP, if we have any questions or we have any, if we need your help on these issues, I hope we can contact you and keep on learning.
Great. Well, thank you both. That was